Hi, I am Suzette Arzolo, a family nurse practitioner in the Emergency Pediatric Department. From a population health perspective, many adolescent injuries are not just accidents, they are warning signs. Behind injuries from motor vehicle collisions, sports, or everyday events, there is often an underlying and unrecognized factor: substance use. The emergency department is a key access point for adolescents, particularly those who may not routinely seek primary care. Adolescence is considered a vulnerable time. The brain is still developing, especially the parts that control judgment and impulse. Evidence shows that screening and early intervention can reduce risky behaviors, prevent repeat injuries, and decrease progression to substance use disorders. Although many adolescents present to the emergency department, screening for substance use is not consistently performed. This is a population health issue and one we can change. Substance use refers to the use of alcohol, marijuana, vaping, and other illicit drugs. These affect brain development, decision making, impair coordination, including reaction time, and increase the risk of injury and incidence of mental health disorders. Here's what the data shows. Older teens ages 15 to 19 have the highest rates of positive screens. Historically, boys screen positive more often, but rates among girls are rising, especially with vaping and cannabis. The CDC's Youth Risk Behavior High School Survey from the Houston area, completed in 2021, showed that African American teens showed a higher use of marijuana, while Caucasian white teens demonstrated a higher use of alcohol. Geography also plays a role. Alcohol related injuries are more common in suburban and rural areas, while urban centers see more polysubstance use. Social and economic factors matter too. Teens experiencing housing instability, lower income, or academic challenges are at a higher risk for both substance use and trauma. We also see a clear time based pattern. Over the past decade, alcohol use has decreased, but cannabis and vaping have surged. Injuries and positive screens spike on the weekends, holidays, and during summer months. And the rise of vaping and fentanyl contamination has created new risks for adolescents. Substance related deaths among adolescents 15 to 19 reached an 8.4 per 100,000 in 2024. This is particularly concerning because this is a largely healthy population, and these deaths are often preventable. So, why is this happening? Teens face pressure from social media, peers, and stress. Substances are easier to access more than ever, especially vaping. And since universal screening is not being done, the problem usually goes unnoticed. As APRNs, we can play a critical role in this situation by using validating tools such as the craft screening test, implementing referral treatment programs, advocating for universal screening policies, integrating screening into the electronic health record, collaborating with behavioral teams and social work teams. To better understand this issue, I collaborated with social worker Andrea Elmore and discussed factors such as social and environmental influences in substance use among adolescents. Hi, Andrea. So I have a few questions for you. From your experience, what are the biggest barriers to identifying substance use in adolescents, especially in a fast paced setting like the emergency department?
I would say some of the biggest barriers would be kids come in with their caregivers, their parents. It's not something that they want to be open about. Being scared of the repercussions and being scared of getting in trouble with the providers. And we can't really give too in depth, and sometimes that can take hours to get information like that. In an emergency department, you don't have that kind of time.
And in your experience, what are social or environmental factors that contribute to substance use among adolescents in our community?
I would say social media is a big factor. It's very easy to get substances that way. They can get it through Instagram, TikTok, and other different types of apps and social media platforms, as well as peer pressure and getting them from their other peers. Or a big environmental factor is if it's something that is done at home, by their caregivers, even if they don't live with them anymore. Oftentimes, kids who have parents who have been into drugs, they often get into it as well.
Hi, Andrea. So I have a few questions for you. From your There are still gaps in what we know. We need more research on substance use, culturally tailored screening approaches, long term outcomes after a positive screen, and how does residing in a high intensity drug trafficking area such as Harris County affect access to drugs for adolescents? Thank you for watching. If this message resonates with you, please share it. Awareness saves lives, and together we can make a difference for adolescents everywhere.